the NCDC has come out to classify status as moderately at risk. And I would like you to speak further, because if this good circulation of respiratory pathogens come together, now I mean, it raises much concern, especially where we have, high indicators of people with compromised immunity. If you look at all our health indicators, even from those with malaria, diabetes and all that, all our indicators are on the high side. So I'm just wondering, with all of this, we are still at moderate risk. Why is that so?
Well, like we do for most outbreaks in a virus, once news like this happen, people start getting word. We do a dynamic risk assessment. What it is that for each disease, we have a technical working group comprising of subject matter experts, people from universities, researchers, our partners, even within NCDC, except they all look together and debate or check all the availability on that disease using specific criteria. One of these they use is, okay, suppose this thing happens, what do you have installed that is in our favor? What makes us vulnerable? They put all this together before they categorize and they are scored. For this one, they score moderate. And somebody say, look, what do we have in terms of readiness? With our past experience, the number of things that are already on the ground that we may need when anything happens. So that's a positive for us. What do you have against? A few ones, huge population, like Riley said. The same stuff we are using for other diseases, the same stuff we have to use again for other diseases. So there is a bit of, the staff may be overwhelmed, those things. So assessing those things, and that's why they categorize as moderate. Moderate is that you're moving now to an alert mode. That's what it means. What is alert mode now? Get prepared. Whatever you have on the positive side, activate them or reactivate them. Whatever you have on the negative side, fill the gaps. Or do something in right now so that you will not be caught unaware. So those are things. And we have the specific pillars when these emergencies happen, like I did tell you, pillars. When it happens, who takes charge? So for any disease, once it gets to that level, we activate what we call the Emergency Operations Center. Activated, in which case now, this is an emergency, everybody comes together from different pillars, from different states, everything like that. We now debate. You give us your experience in that state, you give us your experience in the labs, you give us experience. So they look at that, and based on that, every day we now start planning. What have we done? What haven't we done? Those are the things that are ongoing. For HMPV, ordinarily we never used to track this. But luckily, we are still tracking COVID. We are still tracking flu-like illnesses. We are still tracking respiratory infections. So what we've said is that we add this to that. Now, because we've not been used to track before, what can we do to ensure that? The only thing left now is that the primer that they use, well, more like some reagents for diagnosis. We don't have that. Now we're getting that and distributing. Are you with me? Luckily, to the research facilities that are manufacturing this, either we bring them in or get them out. So we put that in process. And now, for those of them who are now, we need to retrain. There is the various laboratories available now to start retraining. So that's part of the preparedness. Now, I have sentinel sites, like you rightly said, in different healthcare facilities, about 18 now. They are the ones who monitor and track a lot of respiratory diseases. We've activated them. We are supporting them so that now they will actively now start tracking for this HPMV. That's that. Our laboratories, NRL in Abuja here, and CPHL in Lagos, are the national labs. They have the wherewithal. We also have zonal labs, where they have the capacity as established during COVID. All they need to do now, optimize that to be able to test for diseases. Those are part of our preparedness activities. We're getting people there, getting across, notifying the states. Because ideally, a lot of this happen in the states, not in Nigeria.
Precisely. So, sorry, sir. So, before it skips my mind, is that the same reagent that is used for testing COVID that will be used for this?
It's slightly different. It's very different. That's why each disease, they all have their genetic compositions. And to identify that, you have to be specific on what you use to that. This is where collaboration with research institutions or manufacturing institutions comes in. There are people who have specific capabilities to do that. We need to work with that.
So where do we get it? Are we still going to depend on South Africa? Because in the past, you know...
Just yesterday, I spoke to the DG of NIMA. They prepare primers there. Because they developed these capabilities during COVID. And they are developing capabilities again. So we need to look inwards. And one of the lessons is that, look, we will be totally dependent on the external basis. It's about time now we started building those capabilities, and that's what we are doing. Based on our experience in COVID, now started it. They are preparing primary reagents now for mpox or some of the diseases.
Okay. Dr. Idris, you have spoken, you know, to how prepared Nigeria is. You've spoken so much about it. But you keep talking about measures to diagnose and, you know, to trace this virus. You have not spoken about how we would treat it, you know, if it surfaces here. You have not talked about, you know, anything about drugs, vaccines. I mean, way to handle it if it eventually gets here. I want to hear about that.
You know, you mentioned, she said we're going to come back to it. Public health infrastructures. I just said. So this was when you see medical countermeasures. These are things like drugs, vaccines, reagents, consumables that you may likely need depending on the virus or research that we stockpile. You know, you don't wait until this has happened before you start buying. We stockpile. We're already stockpiling. Are you with me? Some drugs, luckily, I would say luckily.
So we're not looking inwards in that regard?
Of course we are. Unfortunately, drugs locally. Look, unfortunately, we don't manufacture antiviral drugs. But again, like say for this kind of thing, you treat symptomatically. Analgesia, hydration, oxygen, right? Those things are available here. You know, Federal Ministry of Oxygen Centers, different across the countries, they can have access to oxygen in case you need oxygen. All these treatments, again, are being done in health facilities, not under the direct purview of NCDC. But again, we all work together. So under that infrastructure, there is of course case management. For a particular case, when you have it, how do you manage it? There are protocols that will now send to the various institutions, send to various health workers. If you see a case like this, XYZ, these are the things, protocols to follow. Those protocols are available. It's all under governance. We send those protocols out to the various institutions to alert them to be on the lookout for diseases like this, so that when you see those cases, you follow the protocol to treat. In those institutions, then you have experts, consultants, just in case they have complications, you can take that over. Take, for instance, for Lassa fever. What kills in Lassa fever? Kidney failure. Now, you can do everything you can, like you can talk to people, but when those cases happen, they have to be treated in hospitals. We don't control the hospitals, but we go hand in hand with those hospitals. But as part of our support, we supply a number of those hospitals with dialysis machines, just in case they have cases who have renal shutdown. They have those facilities to get them out of the situation. So those are medical countermeasures. Vaccines, we stock vaccines just in case, depending on what kind of disease we are dealing with.
So we should rest assured that we're in safe hands?
We're in safe hands, but again, I won't lie to you, we still need to, before we continue to develop, because you don't know what kind of virus are going to come later.